I'm Sam Schroetke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsboro, and this is video number 1 in a series I'm doing teaching you how to treat and get rid of your knee pain. The first exercise in the series of videos is called knee extension and sitting. As we go through this series of videos, we're going to do forced progressions. So the first exercise for knee extension, remember knee extension is straightening the knee, extension, flexion. When I straighten the knee, I'm extending it. When I'm bending the knee, I'm flexing. In most cases, extension is the direction that helps people get better. And I believe the reason why is that we spend most of the day with our knees flexed. Most of us have jobs where we're sitting. And so we're like this most of the day. And the knee or the joint, any joint in the body, doesn't particularly like being in the same position over and over and over. And you can tend to lose end range of motion in the opposite direction. So if we're flexed all the time, we're going to tend to lose extension. And sometimes when I have a patient here with knee pain, I'll film it, and you'll see that if they're coming in for knee pain, they very likely have a lack or a loss of end range knee extension. So these first set of exercises are to help restore extension. The first exercise in the series of videos is called knee extension and sitting. So you're going to sit, let's say it's my left knee that's got the pain, and you're just going to extend your knee. Hold it 1 or 2 seconds, and then back. Extend, hold 1 or 2 seconds, and then back. Every time I'm doing this, I'm really firing my quadricep muscle as hard as I can, and I'm trying to move farther into that range. Extend, hold 1 or 2 seconds, and back. Extend, hold 1 or 2 seconds, and back. Extend, hold 1 or 2 seconds, and back. Extend, hold 1 or 2 seconds, and then back. Extend, hold 1 or 2 seconds, and then back. Knee extension and sitting. You're going to do 10 to 15 repetitions, holding 1 or 2 seconds. Each time going farther into that range and back. Some people are going to do that exercise and they're going to get better, and so there's no need to move on. Because the knee is a weight-bearing joint, however, most people are going to have to do a knee extension exercise with varying degrees of weight bearing. But this is the place to start, and if you do it and it makes you better, then continue with it. If you do it and it makes you worse, don't do this. You're going to want to go do a knee flexion exercise. If you do this exercise and it just has no effect, you don't get better or worse, you're going to want to progress to one of my next videos. I'm Sam Schroetke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsboro, and I've just shown you how to do knee extension in sitting. The dosing for this exercise is 10 to 15 repetitions every 3 to 4 hours. So try to get 5 or 6 sets a day in of 10 to 15 repetitions. If you do this exercise and you have less pain and you're moving more freely with those activities that were giving you grief, then continue to do this exercise for several days. And if after several days you're pain-free or continue to improve, continue with this version of the exercise. However, if after a few days you've plateaued, then I want you to progress to exercise number 2 in this series, knee extension and lying. If you like what you've seen in this video, subscribe to our YouTube channel, click on the little bell. That way you're going to be notified every time we upload a new video showing you how to do one of these powerful exercises for getting rid of your pain. Like the video, share the video with your friends, and leave comments below. Let us know if you tried this exercise and how it worked for you. And if it worked, let us know that, because we love hearing from you about that. And if it didn't work from you, I want to know that as well, because then I can suggest a modification to the exercise which might make it more beneficial to you, or I can steer you toward another exercise that might be more appropriate for you.